Welcome back. A person appears to have it all: beautiful home, family, money, social life, but for so many, that's not the case. The recent suicide of Kate Spade leaves us with a lot of questions. The CDC says depression is more than just having a couple of bad days. So how do you know if you need to seek further treatment for an emotional feeling that seems to just be taking over your life? Joining us live this morning is clinical psychologist Dr. Rafi Wald. Thank you so much. We've talked to you many times before about some hot topic issues in the news. This one hit a lot of people hard. This is a household name, and clearly she was suffering from some kind of depression. So let's kind of go back to the basics. Define depression for us. How do we know when we are just having a bad day or a bad week, and when does it cross the line?
Technically speaking, depression is a group of symptoms, and if you have 5 of those symptoms over the course of 2 weeks, then you can technically be diagnosed with major depressive disorder. So among those symptoms include depressed mood, meaning you're just basically feeling down and blue; anhedonia, which means you have a hard time enjoying things that you normally might enjoy. You have a hard time getting out of bed in the morning. There's something called psychomotor retardation, which means just even going from a sitting position to a standing position can feel physically painful. Feelings of guilt, changes in appetite, changes in sleep patterns, and thoughts of killing yourself.
And so how do you know when it's time to seek help, when you're starting to see some of those symptoms?
Yeah, so what we like to use as the barometer is what we call clinically significant distress, which really isn't an exact defined thing. If you go way back, we've obviously done away with a lot of the crazy things that Sigmund Freud used to say, but what he used to say is everything comes down to whether you're capable of loving and working in a way that you should be able to. So I think that's a good barometer for you to go by. Are you loving and working in the way that you're normally accustomed to? If things are starting to interfere with your daily life, it's probably time to start thinking about talking to someone.
And if you've never been depressed, it's hard to comprehend what someone is going through, but this is a chemical imbalance, right? This is something going on internally.
Sure, it really is, and there are differences in the brains of people that are depressed from people that aren't depressed. This isn't just normal sadness, and a lot of people who have never suffered from depression just say, well, just get through it and suck it up and get past it. You really do need to think of it as a medical disorder that needs to be treated either with talk therapy, which can be thought of as a medical treatment, or with a medication. So it's not just normal sadness that you white knuckle through. It is a serious medical issue that can require treatment. You really can see the differences in sleep patterns and in brain activity of people who suffer from depression.
Suicide. Kate Spade committed suicide according to authorities. What are signs and symptoms for you to be looking for? What do you do if you feel suicidal? What should people be looking for?
Yeah, if you have any thoughts about suicide, and thoughts of suicide in their most benign form, sometimes people will be going to sleep and they'll say to themselves something like, you know, I kind of wish I wouldn't wake up. That's something that people often think when they're starting to have sort of suicidal thoughts, all the way to the point where they actually have a plan and they're intending to do it. Doesn't it shock me that someone that we didn't expect to be depressed and have thoughts about suicide committed suicide? Just because when people really are intent on committing suicide, they don't typically come to people and look for help. When people come to my office and they say, yeah, I'm having thoughts about hurting myself, I might hurt myself, most times they don't want to hurt themselves. They're just in such a desperate place. They want people to understand how bad the situation is, that they really, really need help. People that really are intent on committing suicide a lot of times don't want people to know, because they want to just go ahead and carry through with it.
I always think it's so sad because, and perhaps it's through our job, we know how many resources are out there for people, and there is help, there is medication, there is therapy, and you know, I think it's important to give that information out there when such a high-profile case is making the news. So is there a phone number? What resources are available right here in our area if you're suicidal, if you think you're depressed?
There are suicide hotlines, but what I really want to stress is if you're in a place where you're really close to thinking about committing suicide, let's just make this really easy. Just call 911. Don't mess around with it. Also, if you're thinking about suicide, certainly you want to stay away from drugs and alcohol, because those dramatically increase the risk of a person attempting suicide or successfully completing suicide. So just keep it really simple. If you're thinking about suicide and you're worried that you might follow through with it, go to your local emergency room or dial 911. Beyond that, if you're having thoughts of suicide, it is time to go see a clinical psychologist or a psychiatrist.
There are people who care, and there is a lot of help out there. Thank you so much for highlighting this. We appreciate it, and hopefully it will help at least someone. Farron?
All right, thank you all. Continuing with your health